Raman Narayanan, who's a consultant restorative neurosurgeon, and he's here to clarify our doubts regarding autism, which many of us are not aware as parents and as viewers also. So we are here to clarify our doubts. And good morning, sir.
Good morning, ma'am.
Sir, here we have some doubts regarding autism. Yeah. So basically, what is autism?
Autism is actually defined as what is called a neurodevelopmental disorder. That is, actually people are born with autism. But the problem with autism is, most of the children, unlike say for example cerebral palsy and all that, the manifestations happen immediately. But in autism, what happens is, the children are not diagnosed for the first 1 to even 2 years. Only after over 2 years, the parents will know that the child is autism. So that is the problem. But basically, it's a neurodevelopmental disorder. And of course, there's a lot of genetic component in it, and lot of environmental factors are also supposed to be the cause of autism.
So what are all the basic causes for the autism?
Yes, as I said, definitely genetic reasons have a role. People have found out mutations of various genes which causes autism. Of course, I am not going into the technical details. And then, they have found that, it's common in twins, like that. And if there is a family history of autism, definitely, the chances are more. So there's a definite genetic reason for autism, plus environmental factors. But again, good that you asked this question, because there's a general conception that vaccines like measles vaccine and all cause autism. I want to say that no, it will not. I want to categorically deny this fact. Vaccines cannot cause autism. Children are born with autism because measles and all are vaccines which are taken later.
And doctor, what are all the basic problems the autism child actually faces?
Yes. See, of course, I'm sure you must also see children with autism. See, the problem with autism is they do not have the ability to communicate with others. So, in fact, you can say that they are living in a different world. So, even the mothers, generally, the mothers know the children's language very well. Even the small child, whatever the child says, the mother will be able to pick up. But here the problem is, even the mothers do not understand what the children want, because there's a lot of communication issues. And because of this communication issues, they also have problems with understanding many things, So then they start behaving in a different way. So from that, things start. Slowly, one by one it starts. So obviously, suppose, I want something from you. If I am not able to communicate to you correctly, you will not understand. So what will happen to me? I will start getting angry. Oh, what is this? What I am telling this madam so many times, she doesn't understand. So you understand, no frustration. So this is a problem with autism. Basically, it's a communication issue.
So what are the major issues we happen to see in the brain, at the level of brain?
Yeah. See, of course, we all know that different parts of the brain have different functions. We all know this facts. One area controls movement, one area controls vision, one area controls our talking. That. We all know that. Similarly, there's an area of the brain called amygdala. Okay, this is the deep inside the brain, the middle of the brain. And this amygdala has got a big role in behavior and other things. And there has been a lot of studies which have shown that amygdala is abnormal in autistic children. In fact, I'm sure you know about the MRI. MRI is a test which we do for brain studies, and they have shown that if MRI is done for autistic children and normal children, in autistic children the MRI is much bigger and different shape compared to normal children. Second thing is, autopsy studies, pathology studies, where they cut and look through the microscope and this thing. They have found that the structure of the amygdala is abnormal in these children. So amygdala is one of the main reasons. Of course, there are other areas of the brain, but amygdala is the main reason main area where autism gets effects.
Okay, so then how do we approach the autistic patient, and what are the treatment plans for them?
Yes. See, basically, most of the children can be treated effectively. Actually, before that, I want to actually, the word autism is not appropriate. Actually, it is called autism spectrum disorder. Okay. Because, it is from one end very, very, very minimal symptoms to the other end, extreme end. There are a lot of symptoms, so much so that, it's practically impossible to even contain those type of children. So it's a spectrum of disorders. Okay. So mild mild to moderate symptoms don't need any aggressive treatment, because most of them are, they can manage. In fact, there are so many people who have come up in life very well in spite of being autistic. Some patients, especially children, they have a lot of therapies, like adaptive therapies, cognitive therapies, speech therapies. All these therapies make a big role if the diagnosis is made early and the therapy started early. Of course, that's also a big problem. As I said, by the time the parents realize that there is a problem, it will be almost 2 years. By the time speech and all will be already affected. But if you are able to identify early, then you can address it. But the biggest problem most of the parents face as these children grow up is, these children become very aggressive. Okay, they start biting, they start damaging things. I have got patients who have, they damage TV and all regularly. They push furniture, they throw things, tantrum, extreme tantrum behavior. Because the reason is, as I was telling I am telling you something, I tell you 4 times, even if you don't understand, 5th time I get angry. Even normal people like you and me get angry. Suppose I am not able to convey that to you every time, obviously my frustration and anger will increase. And that will manifest in a different way. That's the reason why these children become very aggressive. And as they grow older, physically they are very healthy also. It is impossible for the parents to control this angry children. So anger and other associated problems is a big risk when they grow older. Okay, and that is also socially effective. For example, I will tell you a small story. One of my patients, of course, he is around 20 something, and his main activity is to sing loudly.
Okay.
So what happened is, they brought him to my clinic and I was examining him. He started singing, so the mother told him, no, don't sing here, we have to talk, you go sit outside and talk. You know what he did? There was actually a young couple waiting for another doctor, in fact, gynecological doctor.
Oh.
He went near the lady, sat near the lady and started singing loudly.
Okay.
The lady didn't understand. She doesn't know that it looks normal. No?
Okay.
The lady created a big issue and slapped this fellow.
Okay.
She thought he is behaving in an abnormal way. So then, we had to go and tell the lady, madam, what you did is not right. He's not a normal person, he's a sick person. So these things, this can happen. Poor fellow, and we can't blame the lady because he looks normal.
Okay.
He looks practically very tall, very well built. Obviously, any lady will get this. Suppose if you don't know me and I come and sit near you and start singing loudly, you will feel irritated, isn't it? So that is always there. So normal behavior. So this type of things can happen. So social issues. Then there are children who go and bite others. Say suppose someone already suppose you are sitting in the next room, you are seeing patients. My patient comes into your room and bites you. How much you will accept it?
Yeah.
You understand? No? So what to do? And then again another incident I had. I was traveling to some foreign country. The family sitting behind me had an autistic child. He was not child. He was some 20-25 years old boy. And he refused to sit when it was taking off. Obviously, it's a big problem, no? That everybody has to sit when the flight is taking off, but this fellow refused to sit. Finally, they had to bring this, this like handcuffs and put him on, till the flight landed. They handcuffed him and so these are all social issues, big social issues, no? So like that. So of course, I can quote many examples like that. So these children are a big problem. And of course, how do you treat these children is by medical management. There are so many medicines which quieten them, which make them listen and calm them. Basically calm them down. You can't improve their behavior and all that. You basically make them less angry, less aggressive and all that. But then again, there is a big problem, because these medicines cause a lot of side effects. So, a lot of parents, after initially they give, but then they lose their enthusiasm because they will see the son or daughter or just continuously sleeping. Now, obviously, no parent wants to see his child sleeping all the time. So that's the problem. So it is there that, as a surgeon, my role comes.
Okay. So what is the role of surgery in these kind of cases, autism cases?
Yes. See, as I was telling you, this amygdala is the problem area in autism. Okay. Again, amygdala has got multiple small areas, and one of the area is called basolateral nucleus. And it is this basolateral nucleus which helps us to communicate and those. And of course, again, I'm not going to take into details. Communicate and all these things. This basolateral nucleus has got we can actually stimulate this from outside and control the symptoms. So what we do is a surgery called deep brain stimulation. That is, we put 2 electrodes into the brain, and through this, of course, nothing is seen outside, everything is inside this. We put a battery here, and this connected, the electrodes are connected to the battery, and we stimulate. Once you stimulate, slowly the aggressive features will come down. And I have also seen that in many children, autism symptoms also improve. But basically, now because we don't have that much experience, we don't have hundreds of experience, we have only a few cases, we have started only recently, 2 or 3 years back. Now we are basically planning this surgery for aggressive behavior. But we have found that all the children whom we have operated, all the patients, in fact I can't call them children, all the people who we have operated have definite improvement in speech and other things, in autistic behavior and attention. In fact, I forgot to mention earlier, attention is a big problem. You can't make an autistic patient sit for a long time. He will get up, he will walk around and all that. You cannot control it. Their attention improves. In fact, I have patients who have attention has improved by 40%, 50%. So what was 1 minute, less than 1 minute has become even 20 minutes. So when they are attentive for 20 minutes, obviously you can communicate with them better. So over a period of time, this therapy is also working. And this surgery is a very simple surgery, pinhole surgery. You do the surgery today and you go home next time. Very simple surgery.
Okay, doctor. So it's mainly a pinhole surgery, you do that?
Yes. Very simple surgery, very interesting. Of course, it's the very costly equipments are used. But obviously, it's all you can understand. In fact, I call them nano surgeries. But obviously, it is costly, but it works.
People are aware of that? These kind of surgeries?
People are slowly getting aware. We are talking to people. We are we are spreading the message across. In fact, that is one of the because as you said, today being the World Autism Day, that is why we thought we'll use this platform to create some awareness among people and all that. Awareness at the moment is not that great, but we have to put some effort.
Thank you so much, sir, for clearing our doubts, and the scope of surgery is there in autism. Many of us doesn't know that, and thank you so much for that. Thank you, sir.